Canada's unelected health overlord committed the country to strengthening the World Health Organization's powers at the World Health Assembly this week, which is fitting if you live in a pharmaceutical industrial dictatorship where citizens have no say. The annual World Health Assembly is coming to a close this week in Geneva, Switzerland. It's a yearly meeting of member state health representatives and private interest groups as a decision-making authority of the World Health Organization. None other than Chief Public Health Officer of Canada, Theresa Tam, was there for one of the plenary addresses. After hitting all of the social justice buzzwords, Tam commits Canada to strengthening the World Health Organization's powers through sweeping amendments to international law and finalizing a new pandemic treaty, accord, or agreement, if they can actually find a title for it.
Let us continue to fight racism, sexual and gender-based violence, and discrimination against marginalized groups, including 2S LGBTQI+ people, women, and girls. And let us renew our support for those on the front lines of care. We have a collective responsibility to ensure the protection of our healthcare workers and condemn the unacceptable attack on them and on health facilities. The many conflicts in the world, including Gaza and Ukraine, serve as stark reminders of the fragile nature of accessing critical health services. Canada urges all member states to support WHO's critical health emergencies work. A strong WHO must also be inclusive, reflecting the entire global community. This means supporting Taiwan's meaningful participation as an observer at the World Health Assembly. This week, we will collectively decide on next steps on both the pandemic agreement and on the IHR amendment and negotiations. Canada remains committed to continuing to work together to prevent and minimize the devastating consequences of future global health emergencies and pandemics, and to further advancing health equity for all. A meaningful pandemic agreement is consensus-based and one that member states can sign, ratify, and implement. Thank you very much.
We've sent a team of rebels to Geneva to be your eyes and ears on the ground at the World Health Assembly as it wraps up, and to cover the Citizens Summit and rally taking place on the final day of the WHA this weekend. You can support that work by going to exposethewho.com and or signing our petition at nopandemictreaty.com. Now, each year the globalist health necromancers gather. I want to know how to keep track of who's saying what. But my previous queries to Health Canada asking this question came back with the media relations team telling me to file an access to information request because that team might have the time to contact all of the delegates and seek that level of detail, but it's not something that is made available to media relations, unfortunately. So much for doing their job. When I pushed back, they simply ghosted me. I emailed. Respectfully, the delegates of the WHA were comprised almost entirely of members from Health Canada and the Public Health Agency of Canada. Did Health Canada and PHAC provide preparations to the Canadian delegates of the WHA? Why or why not? If preparations took place, where can Canadians stay informed on what was discussed and how their delegations were developed, apart from referring back to an international organization and filing an access to information request? Now, for this year's WHA, the list of delegates is supposed to be public and updated, but the page is neither. It's blank. The WHA is a live-streamed event, and multiple discussions called committees are happening simultaneously, so it would be next to impossible for one person to follow all of it in real time. But there are also side events that are not live-streamed happening, and it looks like our very own health overlord Theresa Tam partook in at least one of them. Wait, she didn't just partake. According to her post on X, she actually led the roundtable on strengthening health systems, noting that an important part of this work is providing equal access to immunization so that all people around the world can experience the benefits of vaccination for health and well-being. There's a saying, and it goes something like, health doesn't come from a needle, yet here we are. And since there's next to no publicly available information about this roundtable, I was only able to find a list of side events taking place over the course of this week. This particular one is described as focusing on the critical work being undertaken by the WHO and member states from all regions to prevent, detect, and respond to biological threats, whether they arise from natural, accidental, or deliberate origins. It aims to highlight the WHO's mandate, role, and ongoing efforts to address deliberate disease events and to identify opportunities for further support and multi-sectoral collaboration to enhance health security capacities at the national, regional, and global levels. There's a contact listed, Carla Santos Tellez, so I reached out to her for clarification. As I continue to follow the happenings of the WHA, I intend to report on Canada's participation and how transparently government representatives conduct themselves when representing Canadians abroad. My email begins. Since you're listed as the contact for the side event, I have a few questions for clarification. 1. Where can Canadians learn more about this roundtable? 2. Will Tam's speech or the discussion be broadcast publicly anywhere? Why or why not? And 3rd, how do unelected public health officials ensure that their talking points reflect that of the voting populace of Canada? I gave her a deadline of today to respond, but no response has been garnered. Now, how does this country's unelected lead public health professional have next to no tangible experience in the field apart from a medical degree and a few certificates end up at the helm of global decision-making bodies as some sort of health head of state? For Rebel News, I'm Tamara Ugolini. The mainstream media certainly won't be providing this kind of coverage at the WHA, so if you'd like to chip in to offset our costs and support our work, head on over to exposethewho.com. There you can sign our petition denouncing the pandemic treaty or accord or agreement, whatever it ends up being called, and follow along for our future reports. That's exposethewho.com. Thanks in advance for your support.